The weekend is here, which means a new episode of White Lotus is just around the corner.
Yeah, people are obsessed with the show. Today's medical question is inspired by one of the plot lines. Victoria Ratliff, the character played by Parker Posey, has been using a commonly prescribed benzodiazepine throughout multiple episodes. So, Dr. Darien, the question is, what is Lorazepam and how can it be used safely?
Yeah, so you'll hear it a lot. I know that I watch the show and I do love the show, and I think that it provides an opportunity for really important conversations about medications like Lorazepam that belong to this class of benzodiazepines. So just in general, they're often used to treat things like anxiety, in some cases post-traumatic stress, and in other cases sleep disorders. Benzodiazepine is a class of medications that you can assume are most similar to things like alcohol, for example. When you drink a glass of wine, that's also considered a benzodiazepine, which is why it's so important that you don't mix medications that fall in this class with alcohol. But I think what's most important about this is that these medications can also lead to addiction. They can lead to symptoms of tolerance where you need more to get the same effect. They can lead to dependence where you just need that to just stay stable, and also symptoms of withdrawal. What people need to know is that these medications can lead to withdrawal in their absence, and that can be medically dangerous. I treat medical withdrawal from benzodiazepines, including alcohol, as well as medications, and I'm constantly reminding patients that when you're using these medications, you have to be aware of the signs of addiction, but also be careful when you're coming off of them. You want to ease off of them slowly so that your body can resume its normal activity while reducing the risk of withdrawal.
That's good advice. Your prescription for wellness.
Therapy. You know, we talk about it a lot, but today's prescription for wellness is on one thing or some things you can do to find therapy. It can be difficult, but if you work at it, you might be able to find options in your community or online. So today's prescription for wellness are on some things you can do when you want to start having that conversation. You want to start with people like your primary care provider. You can ask about employee benefits. You can search also, if you're a student, your school website for resources. You can visit even a graduate school clinic for low-cost options. You can often find graduate schools in your community. You can call them up, and oftentimes you can have therapy with students that is supervised by a licensed professional, so it can provide you that cost-beneficial option to get that therapy that you need.
Help is out there and it works.
Absolutely.
All right, Doc, thank you. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.